This is scenario number 4, and what we're doing here is demonstrating how you would prescribe the second pulse for a patient who's coming back after having received the first pulse from the hospital. So when we open the treatment chart, what we would expect to see is that there's a therapy compliance meter on the patient's record that shows that the first pulse was given to the patient, and that's what it shows. The first pulse was given to the patient and the due date is 28/4. We did some updates from the back end to create this scenario, so therefore the dates here sort of reflect what the record will look like a month down the line. So first thing the doctor will need to do is update the therapy compliance meter with regards to the first pulse. So at the top right here, you'd see the button that says edit compliance meters. So click that, and you would see that all the pulses that have been completed and that are due for an update will now show up as a hyperlink. That's the underline, and by clicking on that you'd be able to mark this particular pulse as having been missed by the patient or having been completed. So if the patient completed the medication in time, choose move to completed, and now you'll have to choose a date on which that pulse was completed. So by asking the patient, you might be able to ascertain that it finished yesterday. Okay. Now once that is done, just save changes, and that update is done. Now you can go on to order the second pulse. So the system automatically detects that the first pulse was given out, so it defaults the from milestone to 2, and the doctor can then choose how many milestones to give. So for the sake of the demo, let's say we want to give the clicks aren't working here, and the reason is because the remaining milestone external is ticked, and that's just as a safety feature that has been built in. So to issue the next pulse, the doctor will consciously have to untick the external milestones checkbox, and now this will be drop downable. So if you want to give one pulse, choose 2. If you want to give 2 pulses, choose 3. So just for the sake of the demo, let's choose 2 pulses. And if you come down, you would expect to see that 2 lines have been ordered, and that's what you see. There are 2 lines with MB adult. We'll just default the brand to the government supply and click save. Right. So let's just go back, open the episode to see what the system actually did with the therapy compliance meter. And what you'll see here is that the date that we chose as the actual completion date has been updated on the therapy compliance meter. 2 pulses were ordered by the doctor, so both those pulses are showing up in the ordered status. And the from milestone now moves to 4, indicating that the system knows that the next orderable pulse is pulse 4. But that's not what we're going to do right now. This was just to show what exactly happened on the treatment chart on save. If you expand the little triangle here on the prescribed therapies, you can see you can track what exactly has been going on in terms of the issue of the medication.